Do you have neck pain? Maybe you've had it for a long time. This is something that can contribute to hiatal hernia. Now you say, what does my neck have to do with my stomach? What it really has to do with is your diaphragm, because the diaphragm is very involved with hiatal hernia. What happens is that as the stomach compresses and pushes up, it pushes on the diaphragm, and because of that intrusion of the stomach, you can have the diaphragm not move as freely as it should. That then can lead to heart palpitations. It can also lead to shortness of breath because the diaphragm's not moving as well. That contributes to panic attacks or anxiety. So there's quite a cascade. But what about the neck? The nerve that goes to the neck, it's called the phrenic nerve. That's P-H-R-E-N-I-C. And the phrenic nerves comes out of the base of the neck, the third, fourth, and fifth bones, vertebrae in your neck. And if you've had an injury to your neck, maybe you had a whiplash, you had a sports injury, any sort of injury, but you've had sort of chronic neck issues, the fact that the impulses or the way the brain speaks to organs of the body, and the diaphragm is an organ, is one of the communication systems is from the brain down your spine and out different levels of your back and neck and then those nerves travel to the organs. So as I mentioned, the phrenic nerve, the nerve that goes to the diaphragm, comes from the base of the neck. So if you're somebody who's had a lot of chronic neck pain, that can be another factor that fits into why you're having hiatal hernia syndrome. Now, part of our program here at Root Cause is we have a functional medicine or an internal medicine program, and we also have a physical medicine program. And it's the physical medicine program that would help address neck stretches, neck exercises, various things to help. And then if needed, we could refer you, if you're not local, to a chiropractor, a physical therapist, someone who needs to do some, more local work with you, again, if you're not local to us. But the physical medicine part of our program for hiatal hernia syndrome addresses diaphragm, addresses posture, weak muscles, imbalanced nerves, the vagus nerve, etc. And that's why we have the success that we have in my estimation, and that's why it's very important part of our program to include the physical medicine part. So if you're somebody interested in getting help in this area, we have full programs. We have a course that you can do on your own, although it does include sessions with my clinicians throughout. You can attend a webinar. So there's a lot of things you can do, and I think there are links to that associated with this. But it's time to stop suffering, and I am often asked, what's the physical connection? So I wanted to explain how that nerve going to the diaphragm comes from your neck, and how if you've had neck pain for quite some time, that could be a factor that really needs to be addressed. So I hope you like this video. Please give it a thumbs up. Subscribe to the channel so more people can learn about this, because there are a lot of people suffering and we want to help them.